First to Cape Town, where tuberculosis is in the air. Derek finds out why this deadly disease is making such a dramatic comeback.
When my father phoned me and he said to me, "Mom's been diagnosed with TB," my initial thought was, that's no biggie, TB is curable. And then to find out about a week or two later, now suddenly it's MDR TB.
Multiple drug-resistant TB is an airborne disease. People cough up deadly bacteria for months before they seek help, and that's when they are most infectious. Anita's mother, Linda Skitter, was treated for bronchitis for 4 months before she was diagnosed with multiple drug-resistant TB.
It was a shock. Somebody like me don't get TB. Where do you get it from? I'm a housewife. I go to the shop on Saturdays and I come home and that's it.
How did it all start? I mean, you were an ex-biker, you'd just given up smoking.
At the toll point, at one of the supermarkets. And somebody coughed, just here, because I was wet all over.
For many people, it's difficult to take precautions against this airborne plague. Crowded buses, trains and taxis, busy shopping malls, cramped homes are an ever-present danger zone, even waiting in queues for treatment at the clinics.
Normal TB is effectively treated in 6 months with minimal side effects, but the drugs used to treat MDR TB are far less effective, and so the treatment drags on for 2 years and is very toxic. Extreme drug-resistant TB or XDR is even worse, says Dr. Jennifer Hughes from Doctors Without Borders.
I feel like I'm just feeling in the dark half the time. You know, we're trying various combinations, but people have side effects. They can't tolerate certain drugs. You're not sure which one are you supposed to stop. You're trying to reassure patients, but you just don't know yourself.
The side effects are so ghastly that 50% of MDR TB patients don't leave their treatment. Gomez suffered one of the worst, losing her hearing.
Well, one morning I wake up, turn the TV on, thought the volume must be down. I turned the volume up, still maybe there was something in my ear.
We actually group the patients in terms of their particular infectiousness and the particular disease they have, so that when they're in the wards, we do not oblige them to wear masks.
Dr. Hughes agrees that wearing the heavy specialized masks all day for 9 months is very hard, but essential in highly infectious situations.
You don't know, when you diagnose somebody with MDR, you don't know yet whether they actually have XDR or not. So when you admit somebody with MDR TB to the hospital, there is a risk that they might have further resistance. And if they are not isolated, if they are in the same ward, there is a risk that somebody with MDR TB could breathe in their XDR TB and get a worse disease.
Gomez was discharged from Brooklyn Chest, only to fall critically ill again a few months later, ending up in Liza Nobanda Clinic in Khayelitsha, where she spent another year.
She'd been receiving many months of XDR treatment, the only treatment we had available at that point, and it wasn't working. But we were able to, at that point, start accessing linezolid.
Linezolid is an antibiotic used to treat hospital superbugs. It finally did the trick after 3 years of treatment, and being at death's door many times, Gomez was cured.
How I didn't give up, I don't know really. I had hope.
Linezolid is not normally used for drug-resistant TB. Doctors discovered it was effective in combination with other drugs.
So in Khayelitsha, MSF are working with the Department of Health doctors to tailor their regimens accordingly, and then drugs like linezolid, which the government cannot pay for because they're too expensive, we buy privately and we add it into those regimens.
The problem is that linezolid is not cheap. It costs around 700 Rand a tablet, and patients need to take one a day for 2 years. And the Medicines Control Council won't allow them to import the generic at a mere 25 Rand a tablet.
The Medicines Control Council wouldn't speak to us because Doctors Without Borders have a legal appeal against their ruling. Linda was so frightened by conditions at Brooklyn Chest, she discharged herself and spent 4 months at a private hospital and is now home. She's also on linezolid, but her medical aid doesn't cover it. The minimum dose for the next 2 years will cost her 11,000 Rand a month.
I need people to be aware of the fact that potentially it can kill them. And if they don't have money, it will kill them because they won't have access to the right medication, because the government's also not going to give them the medication that they need to actually get better.
Dr. Hughes and Pomeza lost so many friends to drug-resistant TB that they drew up a manifesto. Pomeza presented it to the 2014 World Health Assembly in Geneva and hopes something urgent will be done.